Fassler. What can I expect at my first appointment?
We have several types of first appointments. We have a shorter visit where you may have something like an acute tick bite or perhaps a sore throat. Those appointments are usually a half hour to 40 minutes long. And we have also a more comprehensive visit where you may come in for an hour and a half to 2 hours, and we spend a lengthy amount of time taking your history and looking at all of the complaints that you have come in for, oftentimes including fatigue and hormonal issues. It's usually not one concern, but a lot of them, and that requires a lot of our time. In addition, at that first appointment, we'll schedule lab work and do whatever relevant physical exam is necessary.
What health conditions do you treat?
First of all, we treat patients who have health conditions. And every patient is unique, and every patient may have a similar symptom, such as anxiety, for a different reason. And so our job is to understand what's causing that particular symptom or complaint in that particular person. We actually have seen numerous health conditions, from ear infections and allergies all the way to quite degenerative disease and everything in between. So there's a healthcare continuum, and I'm going to illustrate it with one hand here and one hand here. And you may be perfectly healthy on this end, and then you may be in critical health on the other end. And we see everybody in between, from great health to crisis intervention. And the situation could have any diagnosis or any itis after it, and we work to reverse the underlying cause of those symptoms.
Can you share about your experience with Lyme and other tick infections?
Absolutely. Our clinic is renowned in the New England area for treating chronic Lyme and co-infections. Dr. Leon Hecht, a colleague in our practice, started this realm of our practice about 17 years ago when he himself was infected, and learned more about it. It's an epidemic in New England, and all of the doctors in this practice are Lyme literate, which means that we have gone and pursued extensive training in how to treat all of the co-infections, what to look for with those co-infections. Oftentimes the testing is very inconclusive and may not give a valuable result because the tests are inaccurate. And the most common Lyme tests, for example, are only 45 to 50% sensitive. So that means that 50% are not diagnosed. In addition, a lot of the word out there on the street is that doxycycline treats Lyme in perhaps 3 weeks. It does not. And many patients need a lot longer treatment plan. And also that particular antibiotic, though useful, isn't the only one that treats a lot of the forms of chronic Lyme, nor does it treat any of the co-infections, which most other clinicians are unaware of.
Can you please share about your experience with women's health?
Certainly. I start seeing conditions around women's health for young women in their teens, and then as they advance into their productive years and postmenopausal years. I'm really concerned at this point with how a woman ages, and I want to make sure that she has a bone structure that keeps her upright for as long as possible. It's very difficult to breathe when you're bent over with osteoporosis. I'm also really interested in her brain function as she ages, and also whether or not she's at risk for cardiovascular disease. Hormones are a really important part of women's health, and I look at those and examine those very closely. And also various cancers that women are at risk for, breast cancer especially, but many others as well.
And how do you help people reverse cardiovascular disease?
Cardiovascular disease starts with looking at a person's lifestyle, and then we do extensive testing. Most of the testing that we do is unavailable in other practices. There's parts of it that are available and parts that aren't. We look at, for example, in the lab work, we look at your blood sugar and all the different aspects of how you control your blood sugar, as well as how inflamed you are. We look at your genetics and predisposition to cardiovascular disease, whether or not you clot well or you don't clot, and then what fats in your diet are you really eating, and we can see that through the blood test, and what fats may be preventing your cardiovascular disease. So we have an extensive exam, and we like to work with other clinicians around how to assess for example, calcification in the blood vessels or plaque in the blood vessels. And then our job is to help reverse those issues and help you to have the longest, healthiest life you can.
Thank you.